Presbyterian Hemby Children's Hospital, kids are welcomed into a bright and cheery environment. The halls here are lined with colorful murals. Instead of a cold and sterile-feeling hospital, the little patients are greeted by playrooms, toys, and a warm staff eager to make their stay more fun and less scary. And 12-year-old Zashid McNeil is a regular here. He's been coming to Hemby for years to treat his disease.
I was born with sickle cell disease, sickle cell anemia. I was only 3 weeks old, just a little baby. My dad and my mom thought I was playing because I kept falling and dragging my feet. One side of my body had shut down. They tested me and found out that I had 3 minor strokes. I started getting blood transfusions. I come here, they draw my blood and stuff, and hooked me up to a big machine. It was like they put new blood in and take out the old blood, the sickle blood. When I met Hemby, it was kind of fun because they got the playroom, the teen room, the outdoor playroom, game systems, and the doctors are great. When I come to Hemby, like the child life specialists, they're great. They play and joke around with me. We watch movies and stuff, and we do fun stuff and fun activities. The child life specialists, they talk to you during what's going on. If you're hurt or injured, they ease your pain. Because of child life and the doctors, I'm not scared when I come in the hospital anymore.
I'm here now with child life specialist Rebecca Brooks. Rebecca, tell me a little bit about what a child life specialist does. What does that mean?
So my job here in the hospital is to make it a little easier for kids and their families to be in the hospital, and to make sure that we're minimizing all the negative effects of being in the hospital while trying to really maximize positive coping and normalization and make it just a little easier to be here.
Being in the hospital can be scary. So what are some specific things that you do to help kids and their families?
We actually do a variety of different things. Our main role really is education. So we provide diagnosis education and procedural preparation, teaching about different procedures and surgeries and tests on a child's developmental level. You know, sometimes doctors and nurses use big, giant medical words that kids don't really understand. So that's a big part of what we do is education. One thing that we really try to focus on during procedures is distraction techniques, or alternate focus is kind of what we call it a little bit. So the idea is just something scary or not so happy is happening on this arm. Maybe let's look over to this side and see what else we can do. So depending on the child or their developmental level, we blow bubbles, we sing songs, we do dances, we look at I Spy books, kind of whatever else, you know, whatever works. We're willing to try anything just to kind of keep their focus on something else. And you know, a lot of times they don't even realize that maybe the blood draw has already happened, you know, because they're so focused on something else.
What is your favorite part of your job?
My favorite part of my job, there's so many. Working with kids is amazing. They are so much more resilient and so much tougher than we are as adults, and I think that, you know, it's nice to come into work every day and have a little reminder that maybe you shouldn't focus on the little things that are stressing you out or bothering you, and just smile a little more. So it's nice to work with kids because they're refreshing. They're very refreshing.
Hemby's world-class doctors, nurses, and the entire staff all work together to make sure your child gets the best possible medical care. Your kids will be taken care of, and along the way, make some great friends. It's just another way that Hemby Children's Hospital is making a difference in the lives of children.